This podcast, including any related materials, such as show notes, links, and supportive materials, is provided by Metagenics Institute, the educational arm of Metagenics, Inc., for general informational and educational purposes only. This podcast does not constitute medical advice and should not be considered a substitute for discussions between individuals and their healthcare providers. The podcast presenters' views are entirely their own and do not represent the views of Metagenics Institute, Metagenics, or any of their research partners and collaborators, collectively referred to as affiliates. Metagenics Institute and its affiliates do not endorse or recommend any specific healthcare providers, products, or other items or services that may be discussed or mentioned in this podcast. Podcast participants may receive compensation from Metagenics Institute and/or its affiliates. Metagenics products are not intended to diagnose, treat, cure, or prevent any disease.
Chances are you've heard of the Wahls protocol, but when you join us for this episode of The Practice, you're going to get the behind-the-scenes scoop on what it took for a once conservative academic physician to overcome direct conflict with the very material she's meant to teach her medical students and residents. Dr. Terry Wahls was diagnosed with multiple sclerosis and found healing through the power of food and nutrition, what she calls therapeutic lifestyle intervention. What Dr. Wahls has provided through her research and experimentation started like all truths. First, it was denied and viewed by some as invalid, but time and rigorous data proved her protocol, changed lives around the world, and challenged the conventional medical view that neurodegeneration is unavoidable and irreversible. Dr. Wahls has sparked new questions to be answered in the realm of multiple sclerosis and other neurodegenerative diseases that have been deemed irreversible.
It felt miraculous, and it was also the first time as like how much recovery might be possible.
Join us on The Practice to hear Dr. Wahls' personal story with multiple sclerosis and how she's living proof that healing is possible. Hi, I'm Dr. Sara Gottfried, and I'm thrilled to be here with my friend, Dr. Terry Wahls. Terry, welcome.
Oh, thank you for having me. I'm thrilled to be here.
I'm so happy you're here. And, you know, I heard your story years ago, and it still is so poignant and so touching to me. So I'd love to start there. I'd like to start with what got you started with all of this.
Sure. So I'm an academic internal medicine doc, which means I teach at a major university here at the University of Iowa. And at that point, you know, I'm teaching my residents to be very skeptical of supplements, of complementary medicine, fancy diets. But, you know, God has a way of changing us. I started having problems with my left leg. I was stumbling, and ultimately I got an evaluation that included MRIs of my brain, my spinal cord, spinal taps, nerve conduction velocities, and I was found to have lesions at the level of my spinal cord. My neurologist reminded me that 13 years earlier, I'd had an episode of dim vision involving my left eye. So now I had lesions, had abnormal spinal fluid, and I had episodes separated by time and space. So I met the criteria for relapsing remitting multiple sclerosis. I was advised to begin disease-modifying therapy, which I did. And like many physicians, I immediately started reading the research to figure out what I should expect, and was quite dismayed to see that within 10 years of diagnosis, one half will likely have to stop working because of severe fatigue disability, and a third will have difficulty needing a cane, walker, or wheelchair, and will experience serious gait disability. So I knew I wanted to treat my disease aggressively. I sought out the best MS center that I could find in the Midwest that was doing clinical research, which was the Cleveland Clinic. Saw their best people. They agreed that I had relapsing remitting multiple sclerosis, and they urged me to begin disease-modifying drugs, which I did. I had just one episode of weakness in the next 3 years, and so had I been in a drug trial, that would be a huge success. But I was experiencing continual steady decline. My Cleveland Clinic physicians told me about the work of Lauren Cordain, which I read his papers, read his book, and decided that there was a scientific rationale behind adopting the paleo diet. So after 20 years of being a vegetarian, a lot of prayer and meditation, I gave up all grains, all legumes, all dairy, and I went back to eating meat. And I continued to decline. The next year, my physicians told me I'd converted to secondary progressive MS. At that point, functions once lost would likely continue to disappear. And so I went ahead and took mitoxantrone, which is a form of chemotherapy. I continued to decline. I did several rounds. I continued to decline. Then my physicians suggested I take the new biologic drug, and I was thrilled to take it. And I continued to decline. And so then they switched me to another disease-modifying drug. At that point, I'm thinking like, okay, the best people taking the newest drugs was not stopping my slide towards a bedridden and demented life, potentially, and a life potentially of uncontrolled pain, because trigeminal neuralgia was part of my problem as well. And so I start reading the literature again, start reading PubMed. I'm looking for the latest drug trials. And then finally I realized I got to be reading about things that I can access. So I start looking for supplement studies, vitamin studies. And there really isn't anything in the animal models for MS, but there is for Parkinson's, Alzheimer's, Lou Gehrig's disease. So I read a bunch of papers and decide that mitochondria are the driver in all these neurodegenerative diseases, and it's probably the driver in MS, even though no one's talking about mitochondria in MS. So I began, again, researching and figuring out a supplement cocktail for mitochondria. I was about 6 months, maybe 9 months into this. I thought, it's not helping. You're wasting your money, and I quit. And I really couldn't get out of bed to go to work the next day, or the next day, or the next day. And then, Jackie comes in and says, honey, I think you ought to take your supplements again. And I did. And I could get up and go to work again. And I thought, wow, that is really interesting. So 2 weeks later, I do the same thing. And again, my fatigue is much worse. I can't function. I can't go to work. And on the third day, I take my supplements again, and I could get up and go to work. So I realized these supplements are reducing my fatigue. That, yes, they aren't making me better, but I am very excited about that. I tell the Institutional Review Board that I'm part of now that I want to review all the studies related to the brain that are human, and so I'm getting more and more comfortable reading research, more comfortable beginning to experiment on myself, and I decide that, I'm happy to take these disease-modifying drugs because I want to slow my decline, but clearly my supplements are doing something really important. By the summer of 2007, I am so weak I can't sit up in a chair like this, Sarah. I have a special chair, a zero-gravity chair that I can recline. My knees are higher than my nose. I am still working. The VA and the university have redesigned my job multiple times. I can walk very short distances, like from here to the wall there, using 2 walking sticks. I'm quite fatigued by 10 in the morning. I'm losing my keys, my phone. I had to replace my smartphone 3 times that summer. So I'm beginning to have issues with brain fog. My chief of staff calls me in to tell me he's assigned me to the traumatic brain injury clinic come January. I'll be seeing patients without residence. And I go home, I tell Jackie, and she goes, Terry, you can't do that job. A couple weeks later, I review an article or a research protocol that uses electrical stimulation of muscles in people who've had a spinal cord injury. It gets me thinking, could I use that for MS? I convinced my physical therapist to let me begin doing eStim as part of my very simple basic workout. Then I come across the Institute for Functional Medicine. They have a course on neuroprotection. I get the course. It's these big case notebook and video lectures that I'm reviewing, taking notes in the midst of my brain fog, so it's really a lot of work.
It's not easy. It's not easy with your brain totally intact.
And I have a longer list of supplements. I add those. And not much has really happened. But now I have another really, really big idea. It's like, I should figure out where these nutrients are in the food supply and restructure my diet to stress more of these nutrients. So I finally find the Linus Pauling Institute of Micronutrients from Oregon, use that to restructure my paleo diet. And December 26th, I start eating this way. Less meat, more vegetables, a lot more vegetables, more organ meat. And in the middle of January, I go off to the traumatic brain injury clinic, and I'm watching my partners for the first week. So I'm just watching, so well, that week goes okay. I'm now like entering my third week of this new way of eating. I'm thinking, my energy's a little bit better, and I'm feeling a little more clear in my thinking. And so now we're in my fourth week, and now I'm going to start seeing the patients. I'm getting up and doing the exam and sitting down, and at the end of the week, I'm like, that wasn't too bad. So I can do this job. And after the third month, I mail a letter. I get up, and I take my cane, and I walk down the hall, and I mail a letter. And everyone's stunned because no one's seen me walk in years. 4 years, to be exact. And then in 6 months, I'm walking around the VA hospital without a cane. And at 9 months, I get on my bike, and I'm able to bike around the block. And what you should know, Sarah, is I had fully accepted that progressive MS is only downhill, that functions once lost do not come back. So I had done the E-stim, I had done the supplements, I'd done all this stuff, not to recover, because I knew recovery was not possible. I'd done all of this to slow the decline. And when you have a neurodegenerative disease, part of the coming to terms with that is letting go of expectations, letting go and just taking one day at a time. And so as I had this remarkable recovery, I didn't know what any of it meant. I was just taking it one day at a time. Well, I got on my bike. My son's jogging on the left, my daughter's jogging on the right, Jackie's biking behind me. My kids are crying, Jackie's crying, I'm crying, and I'm crying now. It felt miraculous, and it was also the first time as like how much recovery might be possible. That the conventional understanding of neurodegeneration of progressive MS is wrong. And of course, by that time, in my clinics, I'm talking very little about drugs. I'm talking a lot about diet quality and exercise and therapeutic lifestyle. And so I've changed how I'm practicing medicine. And of course, I would ultimately change the research that I do, and I'm changing everything.
Your story is so intense. I agree. It is miraculous. And you and I were both trained in allopathic medicine.
Oh, yes.
There's a few places along the road that I hear that I want to go back to and maybe get a little more granular.
Sure.
The first is you had the openness after you were diagnosed to look at the work of Lauren Cordain. And that's not true of every allopathic physician.
No.
Was it the desperation? Was it what was it that motivated you? Like you were just wanting to search for other options besides what was on the table from conventional medicine?
Well, what really helped was I had 2 kids. When I was diagnosed with MS, my son was 8, my daughter was 5, and I'm not wanting to become a financial burden. So I spent a lot of time thinking about what was my purpose in life was to have 2 kids that are successful emotionally and financially, and what could I do? I couldn't teach them resilience by mountaineering and backpacking and kayaking, but I could teach them resilience by not giving up. I could teach them that I could go to work every day, I could adapt as I was getting assigned new tasks, not complain. I could give them chores. They weren't too happy about that, but they had chores and they had real work that they would have to do. But it also meant I had to be willing to do everything that I possibly could. And so when my Cleveland Clinic physician said, you ought to check out the work, from Ashton Embry and Lauren Cordain, I said, well, okay. So I read those papers. They were published, in our peer-reviewed journals. Like, okay. And it was sort of tricky reading them because I was beginning to have a little brain fog even then. And then I got his book for the public that was easier reading. I thought, okay, well, it's something I can do. So it was a big deal to let go of my vegetarian diet. Now, part of me, I had to laugh a lot because my parents were farmers. They kept telling me when I was a vegetarian, Terry, you are wrecking your health. And my dad had already died. My mom had died about 4 months before I'd made this change. So as I was going through my prayers and being meditative about all this, I was saying, I feel so bad that you guys died before, so you didn't get to be hear me
Vindicated. You got
say,
vindicated.
you were right. I may have been wrecking my health with those choices. And then, so I make the change, and, I'm not getting better. And I'm like, well, how long does it take to rebuild a broken brain? Is this like a year, 2 years, 4 years, 5 years, 10 years? I didn't know, but I figured, I got to at least hope that it's possible, so I better stay on this. Yeah. So I was willing to stay on it.
I love that. So when I look back at my experience in medical school, biochemistry I learned, all the basic science, I had about 30 minutes of nutrition. How much did you have?
Oh, I don't think I even got that.
Yeah.
It's
a problem.
Shocking. And we got, did I get anything about exercise? I don't remember that. I don't remember anything about stress reduction.
My perception as I went through my medical education was that these were considered kind of lesser concerns, lesser subjects than the latest immunology, the latest science paper, the latest paper published in the New England Journal of Medicine, the latest Nobel Prize in Medicine and what that represented. And so lifestyle medicine, therapeutic lifestyle, was really not something that I was taught much about. I had to teach myself. Yeah. But you had this openness, which I think is so curious, and also your salvation. I like how you kind of framed it as this was something I could do for my kids. Like, I wanted to show them resilience.
Absolutely. And had I not had children, I'm not sure I would have headed down this journey. But having my 2 kids gave me a great deal of pause. They're watching. And moms, we will do more for our kids than we'll do for ourselves.
Absolutely true.
And so when I talk with my patients, I often take advantage of that. I know you may not be ready to do this for yourself, but you have children that are depending on you. And so it's nearly always they will do that.
Yes, I totally agree with that. I feel like, we know so much about what moves the needle when it comes to your health, especially with lifestyle medicine. The change management is kind of another beast entirely. And I think finding those ways, especially over a long career in medicine, of really understanding how to motivate change is such an important part of the art and science of medicine.
Absolutely. I've become more and more impressed with helping people grow their resilience, growing their internal motivation. Early on when I was doing my research, one of my key research mentors is a dietitian who her area of expertise is behavior change. And so I learned a lot from my dietitian colleagues and utilized that in our research, and then utilized that in my lifestyle clinic, and then working with the behavioral psychologist. So I spend more and more time talking about resilience, why people want to do this, and help them grow their internal motivation. Because that is really the name of the game, is helping people grow their desire to do this very hard work.
To define their why. I think the why is a big part of then getting to the what and the how.
Correct.
So I want to talk a bit about your research, because I think you're adding to the evidence base in a way that I think is so impactful. And I would say, if we look at it objectively, there's still some gaps in our knowledge base.
Absolutely.
What are the gaps, and how are you helping to address them?
At the university, I had a lot of pushback at first. People were very upset that, I wasn't, they were thrilled with my recovery, but they got really nervous when I quit talking about drugs, started talking about vegetables. Like, oh my God, what are you doing? I'm talking about B vitamins and fish oil and vegetables.
It's so threatening.
So I had complaints filed against me, so I had to go meet with the chief of staff and the chief of medicine. And I, had a cart, full of all of my papers. And in the end, they were, won over. And then the local MS chapter wanted me to come speak. And then I got interviewed by their clinical advisory board. And then I got banned because they were afraid that people would hear my story and reject disease-modifying drugs, which are FDA approved and have some proven benefits. And so they thought they were obligated to ban me. So then I had to go meet with my chief of staff and my chief of medicine and say, okay, Terry, what's going on? Why are people banning you? So we had to go through all of that. Now, unfortunately, as I, again, went through the science, then they had me meet with the head of the complementary alternative medicine clinic at the university, who taught me how to document in the medical record that I'm changing physiology, not treating disease, I'm just treating cellular health, and to be very careful to not overpromise.
Yes.
So I was much more clear in all of my public talks after that. Fortunately, in that journey, it became apparent to my chief of medicine, who then became the dean of medicine, and my chief of staff, that it'd be very important for me to document everything that was going on. So I was given first the job of writing up the case, which I did with my treating medical team. And then I got
the N of one case.
The N of one
yourself.
case. Yeah, very important. And that was an interesting experience to get through, but we got that done. And then I got called back by the now dean, who gave me the job of, this is so important, you need to do a feasibility trial. And I said, well, that's not my area of research. I'll get you the mentors, Terry. This is your job. And you can't say no to the dean.
No, you can't.
So he got me the dietitian, Linda Snutzer, who's been an incredible mentor, and Warren Darling. So we wrote up the protocol as precisely as we could. Then I had to secure about $100,000 worth of funding. And, thank you to our Canadian friends. They helped me secure that. And we did the study. Because it was so radical, I had to have a little pre-study ahead of time, because, if you're excluding whole food groups, the dietitians are very concerned that it will not be nutritionally sound. And my nutritionist said, this is the most nutrient-dense diet I've ever analyzed in the 35 years I've ever been doing this.
Why am I not doing this all the time?
She's like, wow. So we did get approval to do the study. But I was still restricted. I could only do 10. We had money to do 20, but I could only do 10. I'd have to file a safety report with the first 10 to show that we hadn't harmed anyone and that the trend is in the right direction. Because with only 10, you're not going to have statistically significant changes. So we did the first 10, and people who were overweight lost weight without being hungry, and that we had improved quality of life, clinically meaningful improvement, really quite dramatic improvement in quality of life, as measured by the short form 36. And we had the fatigue reduction with the P that was really quite large. On a 7-point scale, it reduced by 2.38. Huge.
In 10 patients.
In 10 patients, p-value of 0.0008.
That's amazing. That's really amazing.
So that was like, wow, that was really pretty good. So needless to say, we got permission to add the next 10. And so we continued. And now I had to file a report every 3 months because of all the weight loss.
You were too successful.
So the good news is people lost weight. If you're overweight, you lost weight. but nobody became underweight. So we were able to keep people in the healthy weight. We also measured their mood. So we had favorable changes with anxiety reduction, depression reduction, favorable changes in verbal and nonverbal thinking as measured by computer and pencil paper test. We have MRIs on the second 10, and that data is not even published because I'm trying to find a MS group that's for the control group. So we haven't published that data yet. But it was very exciting data.
That is absolutely thrilling.
Then, well, we've done some other pilot studies that have been randomized and controlled that have been quite favorable as well.
So one of the things that you and I have talked about that I think is really important is that you practice functional medicine in your clinical work at the Veterans Administration.
Yes.
And you did it very affordably in 2 visits a year, I believe about 20 minutes each.
20 minutes each, yeah.
And you had great success.
Yeah.
So can you share a bit about that?
So in the primary care clinics with the where I was staffing residents, they could do primary care kinds of labs. And yeah, we talk a lot about diet and lifestyle. And the residents were primarily running those visits. And I would occasionally get to go in and get them fired up about vegetables, and they'd be stunned with the kind of success that we were able to achieve. In the traumatic brain injury clinic that I'd been sent to originally to force me to take medical retirement, of course, it turns out to be the perfect place for me because there's nothing that you can do for these guys other than give them psych drugs and say, well, you'll recover to whatever you're going to recover. And I come in and say, there's a lot we can do. We can teach you to meditate. I can have you get a step counter, start walking. And I'm going to put you on a gluten-free diet, either as a vegetarian or the paleo diet if you're a meat eater. I made this beautiful little handout about therapeutic lifestyle. And I got 20 minutes, 2 visits a year. And in my traumatic brain injury clinic, I couldn't do any labs. So all I got was education. I could talk to them and give them a handout. And I'd say about half these guys were willing to go on that journey with me. Mm-hmm. And
they said yes to the change management.
I made people really nervous. They're like, oh my. But I learned to be very careful. I wasn't diagnosing or treating. I was just trying to optimize their cellular function to make it easier for the brain to do whatever repair that it was going to be able to do. And the director of the traumatic brain injury clinic could quickly tell by the end of the year who I had seen and who I hadn't, because they were more likely to still be working and still be romantically involved with someone. My residents were getting much more intrigued by the fact that when they had me come in to talk to their patients, nearly always the patient was willing to make these big changes in their diet. And then when they did, their blood pressures would improve, the blood sugars would improve, and their pain would reduce. And so there were 2 faculty staffing, and the other faculty would be a conventional internal medicine doc talking drugs. I'm talking biochemistry, physiology, and vegetables. And I'm thinking, this is not going to work. And sure enough, finally the chief of medicine calls me and says, we got to take you out of primary care. The residents are just getting too confused. I'm like, yeah, I saw that coming. And then what surprised me, he said, I want you to have your own clinic. And so then we established the Therapeutic Lifestyle Clinic. And in that clinic, I could now get to have some primary care labs, so I could do a vitamin D, insulin, glucose, fasting lipids, homocysteine. So that was all that I did. And the supplements I could use, vitamin D, B complex, and fish oil. That was it. I got a dietitian who got fired up by our success, and so we taught in group classes, and we would do an initial intake, then we would have people come back for a support group as a group every other month for 6 months. And we had marvelous results.
So this is such an important point that I want to enunciate, because I think, with allopathic physicians who maybe have one foot still in the allopathic world, and they're starting to check out personalized lifestyle medicine or functional medicine, precision medicine, they look at, kind of the financial cost of the workup. maybe it's $10,000, $20,000 to get all the specialty labs. And I think this is so important
You don't need it.
to realize that you can actually have great success even with the short list of labs that you were doing, even with the short list of supplements that you had on offer.
And keep in mind, in my traumatic brain injury clinic, I could do no labs. No labs. And for the first 2 years, no supplements. All I had was the opportunity to talk with them, to explain that I thought diet was key, quality of sleep was key, and movement was key, and to invite them to go on this journey and say, look, you've been suffering for years. Would be willing to do an experiment, and I would urge them to do the experiment for 100 days when they were ready. And people were often ready. My vets over time really taught me to value talking about why they want to do it, what is their purpose. I spent a lot of time talking about their hero's journey, and that this opportunity for self-reflection, self-experimentation is their hero's journey, that they could, if they can reclaim their health, then this is the gift they could give back to their buddies. They're also struggling.
Huge, huge.
So they taught me a lot. At first, when I first was discovering functional medicine, I was so annoyed with the VA that I didn't have more time. I couldn't get the functional medicine labs, and I was sort of cranky about it. But it was such a phenomenal gift that I had the tools, and the most important tool is inspiring hope, explaining why this might work, and inviting them to do this journey of self-experimentation for 100 days at 100% whenever it is that they're ready to do it, and then come back and let us know how it goes, and come back and ask for help if they need it. That is a very powerful intervention.
So I hope our listeners can borrow what you just described, because I think that 100-day commitment, that container, it's actually considered a gong. There's kind of this ancient process around choosing to commit to a sacred goal for 100 days. So there's some history to this. So I want to take a step back and tell you that I was on your Instagram account. And you had a post that I really loved, and I loved it without knowing this backstory, because I feel like this post was hard won by you. And the post, I'm not going to quote it exactly, but it was something like, vegetables restore biochemical pathways. Drugs disrupt biochemical pathways. Yeah. Did I get it right?
That's close enough.
Close enough. Yeah. Okay. So I absolutely loved it. In fact, I clipped it. I put it in a talk. I gave credit to you, told everyone to follow you on Instagram. And I feel like that's kind of it's part of the victory that you've experienced in academic medicine, in the VA system. And I just kind of loved it on its own, but I especially love hearing the backstory of it.
Yeah, when I think of my life in academic medicine, so 12 years ago, as all this was unfolding, and I've become this new kind of physician, very eccentric, very odd. People really didn't quite know what to make of me. I got invited to give grand rounds because I was invited to give the same talk I gave for my promotion talk, which was supposed to be about my previous research, but I did it on my case report of myself anyway. And people either loved that talk or thought I was just like way too eccentric and
they didn't know what to do with you.
Yeah. So I got a lot of pushback, but I adapted, changed my messaging a little bit, and then got launched on doing this little feasibility study. And every year we have our research week, and so we'd have posters up from our research lab, and we start having these stunning results. And then I started showing the gait change videos, and then we started getting our research published. And so now and then the university started getting cold calls from people around the globe saying, we've heard about Dr. Wahls, and we'd like to contribute to the Wahls Research Fund.
Oh, I like it.
And so the second time they got a cold call with a 6-figure donation to my research lab, I got another appointment with the dean. I was, okay, Terry, like, what's going on? This has never happened at the university before. And so I've gone from this eccentric oddity now to this brilliant visionary because, one, I'm a little socially awkward. I'm sort of oblivious mostly. But I'm willing to do the research. And because I'm not a PhD, I'm an MD, sort of steeped in my own experience and what I've learned through functional medicine, I ask questions that really matter and then hire the PhDs to help me make sure that I have appropriate measures. Mm-hmm. But I don't let them tell me what questions to ask. I ask the questions that really matter.
So I want to get to those questions. What are the questions that are leading you forward?
So the next question that we're trying to explore is, in the newly diagnosed MS patient or newly diagnosed autoimmune patient, if we put them on a therapeutic lifestyle, or we have a newly diagnosed MS patient, we put them on a drug-based therapy, and we follow them for a year. And we'll follow them with clinical measures, follow them with ocular coherence tomography, so some very detailed optic nerve functions, and MRIs. Do we harm them? Are we equivalent to the best that drugs have to offer? Are we better? And we're raising money. We're about 40% of the way there with the amount of money that we need to raise. But I'm very optimistic that we'll secure the funding and we'll be able to get 20 people in each arm to begin to answer that question.
A number of years ago, you published your seminal work, the
Yes.
Wahls protocol.
Yeah.
You're now revising it.
Yes.
And I know you've been editing for a long time. You've been integrating new research.
Yeah.
There's a lot of new data that's going into it. Tell us about that.
Well, it's so exciting. When I wrote the Wahls protocol, people weren't really talking too much about the microbiome. We weren't talking yet about epigenetics. So we have all of the microbiome data that's come in. We have more information that it's not necessarily the species of the microbiome, it's what the species can do, it's their metabolites that help us run the chemistry of life that have this huge impact. So that will be a very, very interesting conversation. And there's a lot more that we understand now about fasting.
Yes.
And the many ways that we can get more ketones into our system with time-restricted feeding, intermittent fasting, periodic fast, the fasting mimicking diet. So we'll be talking about that. My research was just beginning, so we can talk about the fact that I now have several published studies,
Yes.
and the fact that when my book came out, the neurology community thought what I was doing was potentially dangerous. And now the National MS Society actually likes my work. They've given me over $1 million to fund our studies.
That's fantastic.
And they are funding more dietary studies. When you go to clinicaltrials.gov and you put in multiple sclerosis and diet, there are several studies that are going on now. My study, the Swank versus Wahls diet, studies of Mediterranean diets, of low-fat vegan diets, of low-fat saturated fat diets, of a low glycemic index diet, of ketogenic diets, of a fasting mimicking diet. So people now agree that diet matters,
Yes,
and
it
diet
does.
is an important area of study. And then we can look at the microbiome. There are so many studies going on now for understanding what is the impact of the microbiome.
Yes, really important.
So
as we start to wrap up, I want to pose a question to you. So I think a lot about allopathic physicians, and we both trained in that model, and we both had reasons why we looked for an alternative. What would you say to an allopathic physician who's watching us or listening to us right now, who is maybe frustrated with the amount of time that they have per patient, frustrated with the lack of efficacy with a lot of the, pill for every ill that we were trained to do, and maybe is somewhat fearful about stepping away from the devil they know, right? The allopathic model. So what would you say in terms of this arc that you've been on over the course of your career? What would you say to that allopathic physician?
Well, if we don't begin teaching our patients how to create more health in their lives by adopting a nutrient-dense diet, if we don't help people understand that our diet and lifestyle is how we became ill, and that medications may control symptoms, but they don't get to the root cause of why we became ill, your patients will continue to get steadily worse. And furthermore, you will ultimately be replaced by other professions that will have those conversations with your patients. It's not that we have to be necessarily expert in that intervention, diet and lifestyle. We can refer our patients to health coaches for that. But we have to be expert in helping them understand that a therapeutic lifestyle is the key to creating a healing environment for their cells. And if we don't create that healing environment for their cells, the problems that were driving the development of all their symptoms, all their chronic diseases will continue, and they will develop worsening symptoms, needing more and higher doses of their current medications, additional diagnoses, additional medications, and then worsening disability. I would also caution you in that you yourself are at risk because of the enormous emotional strain, physical strain, financial strain that we physicians are under. And if we don't ourselves take care of a therapeutic diet and lifestyle for ourselves and our family, our health will decline. So my first recommendation is begin doing this for yourself. And then begin talking to your patients about why diet and lifestyle are at the root of health.
Impeccable, beautiful. Love it. Any last thoughts or ideas that you want to share?
I'd say one thing that's has been shown in a number of studies, physicians and health practitioners who use elements of a therapeutic lifestyle in their own lives, whether it's a stress-reducing practice, physical activity, or a therapeutic diet, find ways to introduce it and use it very successfully in their own clinical practice. If they don't use any aspect of a therapeutic lifestyle, they never implement it in their practice. So one of the things I've been pushing at the two medical schools in Iowa, the school in Des Moines University and at University of Iowa, is that we need to be teaching our medical students and all of our health professional students how to use a therapeutic lifestyle in their own lives. So our students can survive and thrive during their medical training or nursing training or physical therapy training, so that our students don't suffer from depression, anxiety, and suicide.
Absolutely.
We've certainly had that happen at the University of Iowa. We've had that happen at Des Moines University.
So when you practice these things yourself and then you teach it and pay it forward with your patients, it creates this sense of alignment that I think is essential.
It's very easy to talk about how you implement these concepts if you're doing them yourself. It's very easy. It's very easy to talk about how you manage these dietary changes if you've already mastered them. It's very easy to talk about how I add in a quick meditation if that's part of my practice. It's easy to talk about how I got a step counter. It's easy to get to 10,000 steps a day if that's something that you have done. And patients know when you're speaking from your experience. They love that. They love you sharing that part of your life.
Absolutely. Especially the struggles, because it's not always it's not like an on-off switch.
That's right. They know we are real. They love hearing your personal hero's journey, your struggle.
Yeah.
And the fact that, yes, it's not always all up, it doesn't always go the correct trajectory. It's usually up and down. And your patients will treasure that.
So if people want to support you, if they want to donate to your research fund, how can they do that?
Well, if you go to my website, terrywahls.com, we have a link on there for the About research, and you'll want to direct your donation to the Wahls Therapeutic Lifestyle Fund.
Perfect. Thank you so much, Dr. Terry Wahls. It's just an honor to be with you. I love your work. I think you're changing the world, and I am just so happy to support you.
I'm so grateful. I'm grateful for the entire journey. And I'm glad you're my friend.
Oh, same here. Thank you.
Thank you for being with us for this episode of The Practice. You'll find extensive show notes, including links and supportive materials, over at thepracticepodcast.tv. While you're there, explore other topics and use the Ask and Answer button to ask your burning questions and give your insights about the topic. After all, the future of medicine lies in dialogue, not dogma. Let's transform medicine together by connecting on Twitter, Instagram, and Facebook. You'll find all the links at thepracticepodcast.tv. This podcast, including any related materials such as show notes, links, and supportive materials, is provided by Metagenics Institute, the educational arm of Metagenics Inc., for general informational and educational purposes only. This podcast does not constitute medical advice and should not be considered a substitute for discussions between individuals and their healthcare providers. This podcast does not create a doctor-patient relationship and should not be considered a substitute for the independent professional judgment of any physician or healthcare professional regarding the appropriate course of action for a particular patient or individual. Metagenics does not make any guarantees regarding the accuracy, completeness, or usefulness of this podcast for any particular purpose. Listeners may use this podcast at their own risk, and patients should not disregard or delay seeking advice from their healthcare providers based on the content of this podcast. Participation through the Ask and Answer button is optional, and no participant should feel obligated to provide personal details, including about any diagnosis, symptoms, or other health-related information. Neither Metagenics Institute nor any of its affiliates seek this information, and it is not necessary to participate in the dialogue regarding this podcast. The podcast presenters' views are entirely their own and do not represent the views of Metagenics Institute, Metagenics, or any of its research partners and collaborators, collectively referred to as affiliates. Metagenics Institute and its affiliates do not endorse or recommend any specific healthcare providers, products, or other items or services that may be discussed or mentioned in this podcast. Podcast participants may receive compensation from Metagenics Institute and/or its affiliates. Listening to this podcast does not obligate you to purchase, use, recommend, or prescribe any Metagenics or Metagenics Institute products or services, including their educational materials. Metagenics products are not intended to diagnose, treat, cure, or prevent any disease. Unless approved by Metagenics Institute, this podcast must be used only for personal, non-commercial purposes. This podcast has no independent economic value and is intended to comply with all applicable laws. It may be rescinded, revoked, or amended at any time without notice. Listeners who are patients should talk to their healthcare providers if they have any questions regarding the content discussed in this podcast. Listeners who are healthcare professionals may obtain more information by visiting metagenicsinstitute.com, calling 888-690-8500, or emailing med@metagenicsinstitute.com.